watching Eagle News America. I'm Ace Ramirez, coming to you from Washington, D.C. It's Wednesday, April 28, 2021. We have updates from our correspondents across North America. Thomas Likeness in Edmonton, Alberta.
Alberta changes its vaccine program to target specific regions.
Rani Bayuga in Parisburg, Ohio.
Ohio Department of Health Director Stephanie McLeod relaxes guidance for quarantine restrictions.
May Ann Manzano Garzon in Sicklerville, New Jersey.
Summer Youth Camps 2021 now allowed in New Jersey. And the Governor Murphy announces Your Voice, Your Shot video contest.
Mila Simbulan in Swarthmore, Pennsylvania.
Pennsylvania health agencies and community partners helping Pennsylvanians who cannot leave home to receive COVID-19 vaccine.
Lou Aquino in Grand Rapids reports about Michigan's Attorney General Dana Nessel's project to protect residents of nursing facilities. Nicole Padilla in Baton Rouge reports about Louisiana easing COVID-19 restrictions. Plus, for tonight's roundtable, it's National Superhero Day. Let's recognize today's champions, the capeless heroes of our time. Our coverage begins now. Carissa F. Etienne, the director of the Pan American Health Organization, says vaccine supplies are still far behind this region's urgent need for more doses and urges other countries to donate vaccine doses. Let's take a look.
Our region has demonstrated that it can successfully distribute COVID vaccines quickly and effectively. Yet, supplies are still far behind what is this region's urgent need for more doses. And that's why we want again to urge countries with extra doses to consider donating a significant portion of these to the Americas, where these life-saving doses are desperately needed and will be promptly used. It is no surprise then that many countries in our region have tightened public health measures by extending curfews, limiting reopenings, and imposing new stay-at-home orders. Of course, these decisions are never easy, but based on how infections are surging, this is exactly what needs to happen.
Assistant Director Jarbas Barbosa explains how an interruption in the supply of the AstraZeneca vaccine from India will impact not only the target countries for those doses, but the whole region.
É impacto bastante importante, né? Porque temos 3 países da região que recebem as vacinas de AstraZeneca de Índia, que são Bolívia, Haití e Nicarágua. Com a interrupção de Índia, que hasta agora não está com uma decisão de volver a enviar as vacinas, todos os outros países também podem sofrer uma redução importante, porque as vacinas de AstraZeneca de outros produtores vão ser compartidas para todos. Então, estamos todos muito preocupados com essa situação e, por parte da OMS, por parte de COVAX, em negociação permanente com o governo de Índia para alcançar um acordo que permita ao Instituto de Índia cumprir com os contratos que tem firmados com o mecanismo COVAX.
Britain's Minister of State in the Foreign Office and the Department of International Development, James Cleverly, says the United Kingdom will send 3 mobile oxygen factories to India. Each can provide or produce 1,500 liters of oxygen per minute. A devastating surge in coronavirus infections has exposed India's long dilapidated health infrastructure, including the supply of oxygen, a key treatment for seriously ill patients as they battle the disease.
Well, India is a long-standing and close friend and partner to the United Kingdom. We've seen the horrible images and the suffering. So in addition to the oxygen production support we have already allocated, today we are also providing 3 mobile oxygen factories, each of which can provide or produce 1,500 litres of oxygen per minute, and that will help support India in its fight against coronavirus. Well, we've already allocated quite a bit. We will continue speaking with the Indian government to find out what they need, and we will continue working to support, as I say, one of our longest and closest friendships. And they have stood by us in our times of need, and we are here to support them now. Well, we're responding to what India has asked for. I know our Prime Minister and the Indian Prime Minister will be speaking in the next few days, and we will continue to liaise with India to find out what they need and what we can do to provide ongoing support as they fight this terrible disease.
Britain said Sunday it was sending life-saving medical equipment to India, including ventilators and oxygen concentrators, as the South Asian country reels from record numbers of daily COVID-19 infections and deaths. London will ship more than 600 pieces of equipment to New Delhi to support its fight against the virus, following a request from India and Prime Minister Boris Johnson, pledging the UK would do all it can to help. The first shipment left the country Sunday, arrived in New Delhi in the early hours of Tuesday, with further shipments following later in the week. In total, 9 airline container loads of supplies, including 495 oxygen concentrators, 120 non-invasive ventilators, and 20 manual ventilators will be sent to the country. In related news, the Kremlin said President Vladimir Putin told Prime Minister Narendra Modi in a phone call Wednesday, Russia will deliver emergency aid to the coronavirus hit India. Russian deliveries will include 20 units of equipment for the production of oxygen, 75 artificial lung ventilation devices, 150 medical monitors, and 200,000 packages of medicines. The Russian news agency RIA Novosti cites the Trade and Industry Ministry as saying that the 200,000 medicine packages would be favipiravir, an antiviral medication. In Germany, BioNTech co-founder Sahin voices confidence that the vaccine his company jointly developed with Pfizer works against the Indian variant of the coronavirus.
Wir sind noch dabei, die indische Variante zu testen, aber die indische Variante hat Mutationen, die wir schon mal untersucht hatten und gegen die unser Impfstoff auch wirkt, ja, dass ich dort auch zuversichtlich bin.
Sahin adds, the vaccine is cleverly built and he is convinced that the bulwark will hold, and if need be, they will strengthen the bulwark again. India fears are rising that the variant could be contributing to the unfolding catastrophe. The World Health Organization has said the B1617 variant of COVID-19, first found in India, had, as of Tuesday, been detected in at least 17 countries. The health agency recently listed B1617, which counts several sublineages with slightly different mutations and characteristics, as a variant of interest. But so far, it has stopped short of declaring it a variant of concern, which would have indicated that it is more dangerous than the original version of the virus by, for instance, being more transmissible, deadly, or able to dodge vaccine protections. The BioNTech-Pfizer vaccine was the first to win authorization in the West and has since been deployed in dozens of countries worldwide. Giving an update of the authorization process in China, Sahin said approval was very possible in July. When the coronavirus pandemic reached South America, human activity on the Galapagos Islands in the Pacific west of Ecuador ground almost to a halt, leaving giant tortoises, iguanas, and other endemic species to themselves. A 4-month lockdown starting in February 2020 after COVID-19 was first detected in the region, resulted in a total halt of tourism and near complete shutdown of scientific research.
El 60% de las actividades de investigación planificadas para el 2020 se suspendieron.
No pudimos ir al campo. Pasamos aquí en Galápagos una cuarentena bastante estricta los primeros meses de la pandemia, en la cual no podíamos salir de nuestras casas nada más que para ir a comprar los productos básicos una vez por semana. Yo como biólogo marino pasamos meses, creo que recordar 3 o 4 meses sin poder acceder al mar.
Since July, the archipelago of 234 islands has partially reopened to tourism, but that has been limited to just 6,000 visitors a month, compared to an average tourism. Percent of the local economy is dependent on tourism. Monica Paez, a tourism ministry representative, says with the pandemic, airport closures, and travel restrictions, tourism dropped by 75% compared to the 271,000 visitors in 2019. For today's COVID-19 numbers, according to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 6 p.m. Eastern Time, Wednesday, April 28, the number of cases of COVID-19 reported worldwide is now over 148,963,000. Top 3 on the list of countries with recorded cases: U.S., over 32.1 million, India, over 17.9 million, Brazil, over 14.4 million. To date, more than 3,140,000 have succumbed to this virus. The U.S. leads the countries with the most number of COVID-19 related deaths with over 573,000. Brazil is next with over 395,000, and Mexico with over 215,000. When we come back, updates from Edmonton, Alberta, and Pearisburg, Ohio. This is Eagle News America. Stay with us.
At ako naman si Maiko Maniago at abangan niyo po kami bilang guest performers
sa Letters and Music ngayong darating na Sabado, May 1,
1 to 2 p.m. Siyempre,
dito lamang sa Net 25.
See you!
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
You're watching Eagle News America. I'm Ace Ramirez in Washington, D.C. In Alberta, vaccine rollout is being ramped up as infection rate among younger people is increasing. To tell us more, Bureau Chief Thomas Likeness joins us tonight. Thomas.
Thanks, Ace. Well, there's been a radical shift in how Alberta is handling its vaccination program, and this one makes sense. The province is departing from an age-based rollout to one that targets areas with the highest infection rates. And beginning on Monday, All of the province's supply of the single-dose Johnson & Johnson vaccine will be sent to 2 areas of the province. The Fort McMurray area, which is where our oil sands are. There's a lot of work camps up there, a lot of congregate living, very, very young population up there, but they're not vaccinated, as well as the resort community of Banff, which is in the South Alberta Rocky Mountains. This vaccine will be available to anybody over the age of 30. Now, it's important to note that these communities not only have high infection rates, but as I mentioned, they're demographically younger than other parts of the province. You know, until now, the vaccination effort has been concentrated on older people and medically compromised people, as it should have been. They were the vulnerable ones in the beginning of the pandemic. And that's been reflected now in the infection data. We look at the infection rates in the older groups, they've dropped off dramatically. But where we're seeing the biggest increases now is among younger people. And it's not because they're ignoring public health measures on a wholesale basis. And yeah, there's some of that going on, but that's a minority of people. The big factor is these people have not been immunized. So, of course, they're susceptible to infection from COVID, and it's more contagious variant cousins. This change also gives health officials a chance to tame those outbreaks in these highly infected regions. The province is also targeting certain workplaces for vaccination. This too makes sense. First on the list, meat processing plants. In this province, these plants employ about 15,000 people. You recall the Cargill plant near Calgary was the site of the largest outbreak in Canada during the first wave of the pandemic. A few people lost their lives there as well, hundreds of people infected. Now, workers in these plants are toiling in close quarters. They're in hot, humid conditions. That's just ideal breeding grounds for the virus. And of course, that puts them at a high risk of being infected. Now, to cope with the increasing numbers of COVID patients in hospitals, the province is also reducing non-urgent surgeries by 30% in the major health regions. And this is going to add to that backlog of some 59,000 operations that have already been delayed. The province, quite frankly, is still a long way to go before the pandemic can be declared over. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Ace.
Thomas, thank you. Yesterday, your Prime Minister hinted that vaccine passports will likely be required in Canada. How do people feel about that?
Well, let's turn to the Ipsos polling company to answer that question. In a recent public opinion poll, it was taken at the beginning of this month, we find strong support for using vaccine passports for travelers, international travelers, and large events. But people are less enthusiastic about their role in day-to-day life. Now, 61% of those asked say that only people who have been vaccinated should be allowed to do things that involve larger groups of people. And this would include things like public transit, flying, or attending cultural or sporting events. By contrast, 39% of Canadians feel that limiting activities to only those who have been vaccinated is unfair. They say those who are ineligible are being unfairly treated. Also, what about the people waiting for a vaccine or choosing not to be vaccinated? Why should they be left out? Ace?
Well, it's a new type of discrimination now.
Well, yeah, it is. Well, actually, it's kind of always existed. I know particularly when I lived in the United States, a lot of the anti-vaxxers were upset because their children couldn't go to school because the public school system wouldn't let them in some states.
Tell us about the situation today in Alberta.
Okay, I just got updated numbers from Alberta Health Services a couple of hours ago, and we recorded the 5th highest number of new cases in a day since the pandemic began. More than 1,800 reported today, variants accounting for nearly 2/3 of the active cases in Alberta, and we've got about 21,000 active cases right now. Those variants have claimed the lives of about 81 Albertans so far. The most common variant, the most common one is the UK variant, and that started creeping into this country back in December. But what's troubling is the infection rate. In Alberta, it's still the highest in the country, double that of Ontario, which is in second place. So we're close to a critical situation with healthcare, and these cases are increasing exponentially. Now, what do I mean by that? Well, if you understand how compound interest works, that's what's happening with COVID. Right now, one case of COVID can spawn many times the number in a matter of days. And each of those cases can also give rise to any more. And you've got that snowball effect, just like you do with compound interest. And pretty soon you got a whole lot of cases. Doctors can't stress enough that for the time being, we have to have limited contact with as few people as possible, at least until more people are vaccinated up here. Ace?
I agree. Well, it's quite alarming. And is the vaccine rollout, what the status of the vaccine rollout, is it helping?
Well, actually, I've got some good news tonight on that front. We're getting a huge shipment of single-dose Johnson & Johnson in the next few days. And as I talked about that in my report, all of that is going to the two hot spots, Banff, the mountain resort, and Fort McMurray. And, you know, people as young as 30 can get these shots now. So these are the people that need them. They're the ones getting infected right now. And when they get infected, they're infecting other people. So hopefully we'll start to see a decrease in the new cases as we get these inoculants into the arms of people who live in those areas. There's also going to be additional shipments of Pfizer. Moderna has more stock headed our way, so we'll be able to restock those medicine cabinets and start immunizing more younger people. And again, I want to stress, even though the outbreak is in the younger age group, it's not restless behavior so much as, you know, where do these people work? A lot of them are on frontline jobs, retail jobs, jobs where they come into contact with far more people in a day than I will see in a month. And they haven't been immunized. People my age have. So statistically, they have a greater chance of getting infected. Ace?
Right. Well, you mentioned first J&J, Johnson & Johnson.
Yes.
Johnson & Johnson jab. Before you mentioned Moderna and Pfizer. Is that because it's the only one available right now, or is that a choice?
Well, the J&J has finally arrived. It was approved, I think about 6 weeks ago by Health Canada, but we haven't been able to get our hands on any of it. But it's ideal. J&J is a single dose, so we can get it into the arms of those people, particularly the ones that are maybe working. Like my son spent a month up in the Fort McMurray area because he works in construction up there. And it's the kind of environment where you live in a work camp. He always called it prison with a good wage. You live in a work camp, you're confined there for 3 to 4 weeks, and then you go home for a couple of weeks, and then you fly back. So it's really important that we get these people immunized, and with a single dose, you don't have to worry about the follow-up for the second shot. So that's why J&J is being sent to those two areas. It's just ideal because those people move around. They may get their first shot in Fort Mac, but they may not be back there for several months. Moderna and Pfizer, again, there's storage problems because of the temperatures required, and that's why they're kind of keeping that in the bigger cities where we've got places that can handle the storage requirements. But J&J, no pun intended, is certainly a shot in the arm for our vaccine rollout here.
Thank you so much, Thomas Lightness, Edmonton, Alberta.
Thank you, Ace, and you take care.
You as well. Great news for Ohioans. The state's Department of Health eases COVID-19 restrictions. In Pearisburg, Rani Bayuga reports. Rani.
Thank you, Ace. Ohio has now vaccinated 40% of its population, and this has shown its effectiveness. Thus, access and visitation limits for intermediate care or those with psychological needs has been rescinded. Also, youth 16 years and older who have been vaccinated and are involved in sports and other extracurricular activities and have come into contact with COVID-19 but have not shown any symptoms are no longer required to quarantine. According to the CDC guidance, those who have received their second dose are considered fully vaccinated 2 weeks after their second dose. Fully vaccinated people who come into contact with COVID-19 but are not showing any symptoms are also not required to quarantine. However, if you live in or work in a nursing home or a long-term care facility or other congregate settings, you are still required to follow CDC guidelines for the industry. Meanwhile, Ohio sets a monthly record in business creation. It created 171,073 new businesses just this month. Secretary of State Frank LaRose met with some entrepreneurs at Dayton, Ohio, to connect with business owners and help them with resources that they need to thrive. On another front, Lieutenant Governor John Husted continues talks about TechRed Ohio, where tech training is being made available for employers to train their staff. He also tweeted about career, technical, and vocational training being made available to help Ohioans find quality, good-paying jobs. Perrysburg, Ohio, Ronnie Bayuga, Eagle News. We live in interesting times. Back to you, Ace.
Thank you, Randy. You mentioned something about TechCred. Tell us more about this. What is TechCred?
TechRed Ohio is a basically it's a way for employers to take advantage of grants by the government, the Ohio government. They are investing at least $2,000 per employee and a maximum of $30,000 per employer to educate or upskill their staff. So they're going to learn anything about maybe robotics, IT, cybersecurity. Those things are being made available for employers to take advantage of. And this is a great program to help people upgrade their skills.
I see. So it's a program to upskill.
Yes.
I see. Okay. What is Ohio doing to help retain talent in the state?
Well, besides this, right, besides TechCred, the interesting thing is Ohio is also investing a lot of time, investing a lot of effort also to the high schoolers. So what they're doing is making available internships for high schoolers so that they can also go into a work setting right away. They can experience them here in Ohio. The other thing that they have for Ohio is that the students can take advantage of basically free college courses. Well, in Ohio, what you could do is take college courses while you're still in high school. So they're like your advanced placement programs in the high schools. But now you can also get college credits to earn college credits while you're still in high school. So by giving them this program along with the internship, they want to retain those talented kids in Ohio.
Okay, so what are these programs that are available to high school students that you mentioned?
Well, that's really interesting thing is they're trying to get the high school kids to look into technology jobs. We're talking about, again, it's just like TechRed. They're talking about cybersecurity, infrastructure, cloud infrastructures, things like that we are currently in. They're providing that kind of training for these kids. So it's a very good program here in Ohio.
I see. Tools and ammunitions not only for the current workforce, but for the future workforce, the high schoolers.
Correct, right? Correct. So Ohio is trying to pride themselves with a workforce that's really up there in technology and skills.
Thank you so much, Randy Bayuga, Perrysburg, Ohio.
Thank you, Ace.
Updates from New Jersey and Pennsylvania. Eagle News America will return shortly.
Action!
Tago ka muna. Diyan ka lang, ha?
Ano na nga pala nangyari dun sa lalaking di kilala ang sarili niya?
Si Romeo, ho?
Inaalala na ba siya?
Ito, papuntang Talipapa. Nandyan yung barbarian ni Bruno.
May ganon pala dito?
Ika na nga, umuwi na tayo.
Pero magpapagupit pa ako.
Romeo, hindi ka pwede magpagupit!
Bakit?
Oo nga, Maya. Bakit hindi pwede? Kasi kailangan niya itago ang mukha niya sa malabong buhok niya. Kaano-ano mo nga pala siya? Higit pa sa kaibigan.
Will you wear my ring?
Eagle News America, I'm Ace Ramirez in Washington, D.C. In New Jersey, with some modified safety protocols, summer youth camps in the state will resume this year. In Sicklerville, EBC's Mayan Manzano-Garzon has this story and more.
Thank you, Ace. Governor Phil Murphy today signed Executive Order number 237 permitting summer youth overnight and day camps for the 2021 season. The executive order requires all overnight and day camps to follow COVID-19 health and safety protocols outlined in guidance issued today by the New Jersey Department of Health. Take a look.
Today, I am signing an executive order allowing for our summer camps, both day camps and sleepaways, to open for the upcoming season. And accordingly, the Department of Health, under Judy's leadership, today released the necessary health and safety guidance. We are all committed to a safe and fun summer for our kids. The guidance the department released includes many of the protocols that allowed our day camps to operate last summer, especially for indoor masking and daily health screenings. And these screenings will be especially important for kids at overnight camps. The guidance also provides areas where greater flexibility will enable campers to enjoy day trips and other off-camp activities. As an additional safeguard, we will be requiring that unvaccinated overnight campers and staff receive a COVID test before the camp begins and within the first few days of their session. The department has been in direct contact with our camp operators who are ready and willing to comply with this requirement. And Judy, as I read the laundry list, and it's a good list, it's a smart list, it's very consistent with, I know, what at least New York State is doing. So there is some commonality a lot of commonality, in fact, with New York State and probably with other neighbors. Again, we are pleased, I know I speak on behalf of all of us, that our health metrics are allowing our summer camps to plan for the season ahead, and we hope everyone can make the most of the summer and take away some great Jersey summer memories.
In other news, Your Voice, Your Shot video contest, which urges New Jersey residents to share why they and others are getting vaccinated, is launching today. The contest calls for compelling, creative, and captivating video. After the submission window closes, a select number of finalists will be chosen. The public will then be invited to vote on their favorites. The winning video will be used in the state of New Jersey's COVID-19 public health campaign. Take a look.
To help us reach our goal, we want to empower you to help us get the word out about how easy and important it is to be vaccinated. Just spending a few minutes on Facebook, Instagram, or TikTok tells you that our state is home to countless talented, creative, and passionate individuals. Social media has meant that anyone with a cell phone, a story, and a vision can become an influencer. So today we are announcing our Your Voice, Your Shot video contest, calling on you to share why you are getting vaccinated. One 30-second video will be voted on by your fellow New Jerseyans to become a central part of our statewide COVID-19 public health campaign. Go to covid19.nj.gov/yourvoice to learn how you can enter Your Voice, Your Shot and be a part of our effort to win the fight against COVID. No state has our grit, our determination, or our creativity.
For New Jersey's latest COVID-19 numbers, the Department of Health has reported another 1,838 new positive cases today, bringing our statewide total to 869,343. Sadly, we are also reporting 35 new confirmed deaths, pushing the total to 22,884 fatalities. On the brighter side, the latest total of fully vaccinated people in New Jersey is now 2,915,754. To know the latest on New Jersey's vaccination progress, visit covid19.nj.gov/vaccine. And as for quick weather updates, currently 10:17 in the evening. Here in New Jersey, it's currently cloudy. It is 73 degrees Fahrenheit or 23 degrees Celsius. So it was unexpectedly warm and nice today. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to you, Ace.
I love this warm weather. Don't you?
Me too. But we don't want to make Thomas jealous.
That's right. Okay, so you mentioned the opening of summer camps. What are the COVID-19 guidelines for this?
Yes, Ace. So to mitigate the transmission of COVID-19 in the summer camps, the Department of Health requires daily health screenings for staff, campers, and volunteers, the use of infection control protocols such as face masks, cohorting, social distancing, hand hygiene, cleaning, and disinfecting, and the policies and protocols for when a staff member or camper receives a positive COVID-19 result. Also, for overnight camps, unvaccinated staff and campers must receive a negative test result within 72 hours of arriving on site. Ace?
Is there any reaction from Governor Murphy concerning New York's opening up bars and lifting curfews?
Well, Ace, for sure, he is in a very difficult situation now because literally New York is just a few minutes from here. Of course, if we don't open our bars, New Jerseyans could easily drive up to New York to go to bars. So, well, he said in today's briefing that we will see him accelerating the reopening of the state, and he also hinted that there will be more news on Monday. So I will keep you posted. Ace?
Okay. Well, before we let you go, do you have an entry for that contest, Your Voice, Your Shot?
Well, Ace, I would love to submit an entry because, of course, I'd love to share my vaccination story, but I think I might need to brush up on my video editing skills. Ace.
Now you have time. Thank you so much, May Ann Manzano Garzon, Sicklerville, New Jersey.
Thank you, Ace.
Pennsylvanians who find it difficult to travel to and receive the COVID-19 vaccine at inoculation sites now have a chance to get vaccinated at home. In Swarthmore, Bureau Chief Myla Simbulan tells us how. Myla.
That's right, Ace. Good morning, Ace, and good evening, Ace, and good morning to all our viewers from the other side of the world. As Pennsylvania continues its accelerated COVID-19 vaccination plan, Pennsylvanians who are not able to leave their homes must be reached, and various state agencies and community groups are helping. Here is Secretary of Aging, Robert Torres, to tell us more. Take a look.
The Department of Aging is committed to helping all segments of Pennsylvania's older adult population obtain a COVID-19 vaccine. This includes older adults who are unable to leave their home, such as those that need help of another person or would need to rely on medical equipment to leave their homes, or whose health could get worse, making a trip for the vaccine either impossible or impractical. Vaccinating seniors unable to leave their home is an issue that we have focused on within a subcommittee on aging, which I have been leading for the past 2 months. And it is an issue that requires us to mobilize and collaborate to fit the needs and the resources of each community. The area agencies on aging have been doing an excellent job collaborating with community partners to help older adults obtain their vaccine appointments. Now we're seeing these agencies and counties build upon successful models to find creative ways to reach seniors who are unable to leave their homes, such as partnering with emergency medical technicians and visiting nurses. We appreciate the ongoing support of the governor and the Department of Health to help us further advance these efforts.
Collaborative efforts are already taking place to locate people who cannot leave their homes and get them vaccinated, including those Pennsylvanians who are not receiving services through the Department of Human Services or the Department of Aging. Acting Secretary of Health Allison Beam amended an order to ensure vaccine providers are working with local AAAs and other groups to reach those who are not able to leave their homes. The order was originally signed to connect providers to AAAs, which lead to great success to reach those 65 and older who were having difficulty obtaining vaccine appointments. While it is difficult to pinpoint the number of Pennsylvanians who are not able to leave their homes, the state and its community partners are committed to using all means of outreach to ensure everyone who wants a vaccine can get one. Right now, Ace, here in Swarthmore, it's 78 degrees Fahrenheit or 25 degrees Celsius with cloudy skies. It's just between us, Ace, don't tell Thomas. In Swarthmore, Pennsylvania, Mila Simbula and Eagle News, we live in interesting times. Back to you, Ace.
I guess Thomas is getting it tonight. Okay, so what are the steps health agencies in Pennsylvania doing to reach out to those individuals who cannot leave their homes and want to get a vaccine?
So all those local health, county local health facilities, they are collaborating with AAAs, and different counties are finding different ways to reach seniors who cannot leave their home. They usually partner with emergency medical technicians or EMTs and visiting nurses. Actually, here in my county, which is Delaware County, vaccine providers and teams of EMTs are mobilized so that they can help those individuals who, especially the seniors, who cannot leave their homes. Ace?
I see. Okay. So what is the current vaccine mobilization in Pennsylvania?
Pennsylvania is doing great. Actually, in here in Pennsylvania, 50% of its eligible population has already received the vaccine. And the state ranks 10th among all 50 states for the first doses administered by percentage of population. Pennsylvania also ranks 5th among all 50 states for total doses administered. Vaccine providers have actually administered more than 8 million vaccine doses. Ace?
This is the way that we're getting closer to our goal, which is to reach the herd. That is what we're trying to do here all across the nation. Have you had your vaccine?
I actually had my vaccine, Ace, Tuesday last week at a local hospital near me, and it was actually an interesting experience. I didn't expect that there will be that much people. I'm not used to anymore, but it was really organized. There's a couple of lines that you have to go to, a line to get the form, and then you have to fill it up, and then you go to another line for the shot itself. I overhear one of the nurses saying that they had 60 people every 30 minutes. They have an appointment for 60 people every 30 minutes. That's why there's a lot of people. I guess that location I went to is a mass vaccination site. But they're really organized. The lines are organized and everyone's helping. And it was quick. Actually, for about 30 minutes, I was inside the hospital and I was able to, go home right away. So yeah, it was, the shot was here on my left arm, and I didn't have that much, effect afterwards. There's just a little bit of pain over here, but that's it. Ace?
So did you get the Moderna or Pfizer?
I got the Pfizer.
I see. Okay. All right. Thank you so much, Mila Simbulan, Swarthmore, Pennsylvania. Up next, updates from Michigan, Louisiana, and tonight's roundtable, if we have time. We'll talk about capeless heroes of our time. Eagle News America, we'll be right back.
Innovation, digital disruption, globalization. Startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. Your weekly dose of entrepreneurial inspiration to update you on the latest developments in the world of business. Get up close and personal with CEOs and thought leaders to help you discover valuable insights, sharpen your instincts for smart decision making with the latest markets and economic trends, disruptive ideas, global innovation, social entrepreneurship, and other leading-edge business ideas. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business, from vision to action.
Welcome back. This is Eagle News America. I'm Ace Ramirez in Washington, D.C. In Michigan, Attorney General Dana Nessel announces a project to protect residents of nursing homes in the state. How will the initiative work? Eagle News correspondent Lou Aquino has the details.
Thank you. Michigan's General Attorney Dana Nessel announced a new initiative to protect vulnerable adults living in nursing facilities. This new initiative, called the Sentinel Project, will use specially trained staff to examine long-term care facilities for evidence of abuse or neglect through unannounced visits. The unannounced visits will be determined by complaints, performance metrics, and other data. These details were discussed by Attorney General Nessel in a video announcement. Take a look.
This is Michigan Attorney General Dana Nessel, and I want to tell you about a new initiative in my office, the Sentinel Project. The goal of the Sentinel Project is to identify abuse and neglect that may be taking place inside Michigan's long-term care facilities. The project will involve specially trained staff using a variety of performance metrics, complaints, and other data to target facilities for unannounced visits by a Sentinel Project field team. These teams will conduct discrete but comprehensive site investigations to determine if evidence exists to take enforcement action, criminal or otherwise. If so, my office will take that action. If you have information about a particular facility you'd like us to know about, please reach out to the team by calling 800-24-ABUSE. Together, we can help improve the quality of care in Michigan.
According to Attorney General Nessel's office, the Sentinel Project will help the state prepare for a projected influx of individuals who will require assistance in nursing facilities. That's based off of the Population Reference Bureau data projecting the senior population in the United States to reach over 90 million by the year 2060. The increase in older adults is often referred to as the silver tsunami. The Attorney General's office says that even though the Sentinel Project is a law enforcement effort within their office, the project will work collaboratively with industry and regulatory partners in order to achieve the best results for Michigan citizens. In Grand Rapids, Michigan, Lou Aquino, Eagle News, we live in interesting times.
Thank you, Lou. Pandemic restrictions are easing in the state of Louisiana. These include policies on mask wearing, waiting areas, and outdoor crowd limitations. In Baton Rouge, Nicole Padilla has the details.
Thank you, Ace, and hello from Baton Rouge, Louisiana.
As COVID hospitalizations are decreasing and the supplies of vaccines are increasing, Governor John Bella Edwards announced Tuesday that some mitigation measures will be eased, such as the mask mandate, which was lifted Wednesday. Mask policies will now be set by local leaders and business owners. However, masks will still be required on public transit, in state government buildings, K-12 schools, early childhood education centers, colleges, universities, and healthcare facilities. Louisiana joins the Centers for Disease Control and Prevention and other federal and medical officials in recommending that people wear masks in public or when they are with unvaccinated people outside of their households. All Louisianans 16 and older have been eligible for the COVID-19 vaccine for more than a month, and Louisiana was one of the first states to broaden vaccine eligibility to the full population. Governor Edwards said, "I want to be clear, this is not the end of wearing masks in public, as COVID-19 and the spread of variants are still a real threat in our communities. Louisianans should respect each other and businesses and places where masks will be required as we move into a new phase of slowing the spread of COVID-19 in our communities." The order also eases restrictions on live music and allows some businesses, like salons, to reopen their waiting areas. Outdoor events will no longer have crowd limitations. The Louisiana Department of Health recommends that the public follow the 2 out of 3 rule to keep themselves safe during COVID. When in doubt about whether to wear a mask at a certain activity where people outside of a person's everyday household will be present, they can stay safe by making sure everyone around them is vaccinated or maintaining the 2 out of 3 rule. To lower risk for COVID-19, make sure the activity meets 2 out of the following 3 conditions: outdoors, distance, and mask. I hope you are doing well there, Ace in Baton Rouge, Louisiana. I'm Nicole Padilla, Eagle News. We live in interesting times. Back to you, Ace.
Thank you, Nicole. Today is National Superhero Day. Growing up, most of us were fans of at least one superhero. These times, we all agree superheroes do not necessarily have to have extraordinary powers to save the day. In fact, we see signs all over that say heroes don't always have to wear capes. Tonight, let's ask our team who they consider their modern-day champions. But before that, let's go down memory lane and ask first, growing up, who were our favorite superheroes? Let's start with the only rose among the thorns, Myla. Who's your favorite fictional superhero and why?
When I was a kid, my favorite fictional superhero was Wonder Woman. I don't know, I was so amazed when I was a kid. Every time I watched the cartoon, every Saturday, the Saturday cartoons, I was amazed at her powers, and especially the new Wonder Woman shows I've been watching. The way she moves, the way she all her magic lasso, and her even her jet, because it's an invisible jet, right? So it's always amazing what she does.
So if you had a superpower, what would that be?
If I have a superpower, I would like to be able, because I always multitask. I want to have multiple hands so that I can do things at the same time. I have to cook, I have to do laundry, I have to iron and things like that. If I can do that, because now we're getting old and it gets so I get so tired easily. So yeah, that's the superpower I want. I wish.
Okay, so real quick, who's your modern day champion?
My modern day champion is the leader of the church I'm into. His name is Brother Eduardo Manalo, and because of what's happening right now, he never stops. The church never stops with his leadership in providing help to others, even in the time of the pandemic. They've been doing this for such a long time, but during this pandemic, they've been doing more. Abe?
So much respect for the Church of Christ executive minister. Let's go to Thomas. Thomas, thank you for sharing, Myla. Thomas, okay, share with us, who's your favorite fictional superhero?
Well, you know, I was always a Superman fan as a kid. He's still ranked as the most popular, even ahead of Spider-Man. But yeah, Soup was always my favorite.
And if we had superpowers, of course, that would be.
Oh, I would like to have everything he had, plus time travel. I'm not sure. Could he go back in time? I'm not sure. But time travel is one I would like to have in addition to what he had. Love to fly around and, I get a good dry cleaner for my cape. And yeah.
I think there was a movie where he turned the world around.
He would turn the world backwards.
Right, that's right.
And,
but for you, superhero.
I'm sorry, say again?
Who's your modern day superhero? Who do you consider?
You know, our superheroes today, they're probably all over your neighborhood. They're like the young kid who sets up a lemonade stand and gives his profits to a children's hospital because his best friend has cancer. Or I think of my neighbor Jerry across the street. All winter long, he's clearing sidewalks for seniors, getting rid of the snow. Summertime comes along, he doesn't take a break. He mows their lawns. There's hundreds of them in your neighborhood. Unsung heroes, but to me, they're also superheroes. And, it's their efforts that make that's the glue that holds our society together and makes our society stronger. Ace?
I agree. Thank you. I think you've mentioned Jerry a couple of times already in our
I have.
Favorite Jerry. Thank you, Thomas, for sharing with us. Randy, let's go to you. Okay, you're a fictional superhero. Let me guess. Wonder Woman.
I did like Wonder Woman. She was cool. Because, she's got that invisible jet and she can go anywhere.
Uh-huh. But really, who is it?
I was a Spider-Man fan. And so, yes, I really like that, he was able to swing all over the place. He was strong. He was very cool.
So if you had superpowers, what would that be?
Actually, I'd probably like to duplicate myself, like multiple Ronnies all over the place. It just
that would
sometimes that helps in my life.
Okay, so your modern day superhero. Who do you consider?
I take my hats off to the medical profession. So doctors and nurses, especially through this pandemic, they've experienced a lot and they've sacrificed a lot. But it's an everyday thing for them to save lives. Also.
I agree. And we always give them a shout out every end of our broadcast. The frontliners, the medical workers, the healthcare workers, they're risking their lives in service of the nation of us, right? Well, for me, my modern day superhero, aside from the healthcare workers, I really have much respect for the people who pick up our trash. We don't really pay much attention to them, but their work, their job it means a lot to the community, to the city, wherever we are. And if we don't pick up the trash, it's going to be a huge problem. But thank you so much, guys, for sharing your thoughts tonight for our National Superhero Day. But as always, at the end of every broadcast, we do not forget to recognize the efforts of our healthcare workers, first responders, and essential workers by giving them a round of applause. Thank you for being our modern day heroes. This is today's Eagle News America. Thank you for joining us. I'm Ace Ramirez. We live in interesting times.